The next comes the color for the anterior teeth. So how would you select the color for the anterior teeth? So before selecting the color for the anterior teeth, some basic concept about color that you should understand. What are those? The first is the hue, second is saturation, third is value, and fourth is translucency. What do you mean by hue? The hue The hue refers to the specific color that is produced by a particular wavelength of light. So it can be any color like orange, red, green, etc. Second is the saturation. Saturation, or it is also known as chroma. The saturation, it signifies the intensity or amount of color per unit area. So highly saturated colors, they lack depth, so balance it is necessary to avoid an artificial look. The third is brilliance or value. The brilliance or value, it denotes the lightness or the darkness of an object. So it is about the diluting the color with black or white to produce either lighter or darker shade. Another important property is translucency. Translucency, it is the property of partially allowing light passes through an object. Suppose this one is an object and you are passing a light through it. If the light passes through it, then the object is said to be translucent. So remember, the teeth, especially the enamel, it possesses high brilliance and translucency. So the artificial tooth should replace and replicate this property for a more natural appearance. Now let us discuss what are the factors that would affect the tooth hue and brilliance. The first is the age. Well, the younger individual, they tend to have a lighter teeth. This occurs due to the translucency of enamel, whereas the older individual, they have a darker and more opaque teeth due to secondary dentine deposition. So that reduces the size of the pulp chamber. Other affecting things could be habits, complexion, eyes, and hair color. All contributes to overall appearance of tooth that should be considered while selecting tooth color for the most natural outcome. Now, what are the factors that affect the tooth appearance and the color selection? First of all, what is the aging effect on tooth appearance? Well, the teeth in the older individual, they look shiny because of regular wear of the teeth over time that can result in smooth appearance, giving older individual teeth a shinier look. Apart from that, you would see brownish tinge and discoloration that occurs due to the exposed dentine that tends to stain over time. Habits like smoking, alcohol consumption, pan chewing can cause tooth discoloration due to the stains. So porcelain teeth, they are preferred for individuals with such habits. Now what are the steps in selecting color for the anterior teeth? The reference point on the face for the tooth color selection could be side of nose, under the lips with the incisal edge exposed. So that indicates how the tooth would appear when the patient is relaxed. Under the lips with the mouth wide open, only cervical third is covered. That would provide idea of tooth appearance during a smile. Next important part is what is squint test. So what is squint test? It is effective method used by dentist to assess and compare the color harmony between the artificial teeth and the patient face. So what is the primary objective of the squint test? It's to evaluate and compare the color of artificial teeth with the natural color of the patient face. So the dentist partially closes their eyes to reduce the incoming light, creating somewhat blurred vision. While squinting, the dentist compare the artificial teeth of different shade with the color of the patient face. Now the dentist notes which color tooth fade first from their view while squinting. The tooth color that fades or blend more seamlessly with the face color is considered less contrasting. So the color of the teeth that fades or blends into face color first during the squint test, it is it is perceived as least contrasting. So this test would aid in selecting a tooth color that closely matches the natural appearance of the patient face. Now, now let us discuss the selection for the posterior teeth for the denture. So where key factors here are considered, the first is the buccolingual width, second is the mesiodistal length, and third it's the occlusogingival height. The buccolingual width, it refers to the width of the tooth from the cheek to the tongue side. So it is important to decrease this width to allow the buccal and lingual surfaces of teeth to slope out from the occlusal surfaces. So this slope would provide an appropriate path for food during chewing. So if the buccolingual width it increases, then the force acting on denture would also increase. That would increase the rate of the ridge resorption. So broader teeth can encroach on tongue space, causing instability in the denture. Also, cheek biting can occur that can cause discomfort and instability in the denture. The second is the mesiodistal length. It is important to ensure that the combined length of all posterior does not all the posterior on one side of arch, it does not exceed the distance between canine and the retromolar pad. So placing posterior teeth over steep anteroposterior ridge slopes can lead to forward displacement of the denture. Similarly, placing teeth over movable tissue like the retromolar pad, it can cause tipping of the denture during the function. The third is the occlusogingival height. It refers to the height from the biting surface to the gum line. So this height, it is determined by the available inter-arch distance. So suppose if you select a larger teeth in case with the inadequate interocclusal distance, here the altering the thickness of the denture base can be one of the way to accommodate the large teeth while ensuring a natural appearance and proper function of the denture. So to accommodate larger teeth in case with insufficient interocclusal distance, modifying the denture base thickness can be done, allowing proper teeth arrangement without appearing artificial. So the occlusogingival height of the posterior teeth, it is determined by available inter-arch distance, positioning the occlusal plane at the midpoint for the optimal function.